Thank you so much for joining today's webinar on connecting returning citizens with ID and bank accounts. My name is Amelia Josephson, and I'm a senior manager at the Financial Health Network, a nonprofit that unites business leaders, policymakers, and innovators to design and implement solutions that improve financial health for all. I'm joined today by co-hosts Alabama Appleseed and TYTHEdesign, by our presenters who will be sharing learnings from their Alabama pilot projects, and by Diane Standard from the Consumer Financial Protection Bureau. During this webinar, we'll provide an overview of some of the unique FinHealth and ID-related challenges faced by those returning from prison. Throughout the webinar, through a series of 4 presentations, we'll share insights and best practices from pilots that explored methods to develop pathways for providing ID to those leaving prison, approaches for social services nonprofits, parole and probation departments, and other stakeholders to connect returning citizens with IDs and safe and affordable financial products as part of a reentry financial health strategy, and opportunities to work across sectors and engage incarcerated and formerly incarcerated individuals in pathways and programs that support reentry. I now want to turn things over to Leah Nelson, Research Director at Alabama Appleseed, to share some context for the presentations you'll hear today. Over to you, Leah.
Thanks so much, Amelia. So for context, about a year ago, Kay Ivey, the governor of Alabama, signed a bill into law requiring the Alabama Department of Corrections, or ADOC, to work with the Alabama Law Enforcement Agency, or ALEA, to issue a state non-driver ID to all individuals leaving prison. Under this law, ADOC was also required to provide those individuals with supporting documentation, including a social security card and a birth certificate, if they consented. So some states, including some that might be represented by some of our attendees today, probably already had programs to help eligible incarcerated individuals secure state-issued IDs, but in Alabama, this law was a recognition that ID is a necessary part of safe, successful reentry. And we know many states around the country are in a similar position. So there are several reasons that people leaving incarceration might not have ID. They may never have had a driver's license or a social security card or a copy of their birth certificate. They might have lost these pieces of documentation. Some of that ID expires, and it could have expired while they were incarcerated. Or sometimes their ID might have been suspended due to non-payment of fines and fees. Here's the thing. Even now, a year after that law was passed requiring ADOC to work with ALEA to provide IDs to re-entering citizens, most people who leave Alabama prisons do so without the required documentation. I'll turn it back over to Amelia.
Thank you, Leah. Beginning in 2021, the Financial Health Network's Innovation Incubator, the Financial Solutions Lab, partnered with Alabama Appleseed to convene a network of cross-sector stakeholders to explore these questions of ID and financial services access. We asked the role that different community stakeholders can have in solving these challenges, and we gave grants to the presenters that you'll hear from today. We've invited all of you on today's webinar to hear about these projects because the lack of ID and financial services access for returning citizens isn't just an Alabama problem. It's a problem in many states and localities around the country. And as we'll hear, for many returning citizens, lack of ID can limit employment and housing opportunities, as well as preventing individuals from opening accounts at banks and credit unions. I'm excited to pass the mic to our presenters in just a moment. One overarching theme across the different pilot projects you'll hear about today is really a spectrum of approaches to engaging state and civil society entities, assisting justice-involved individuals at different stages in the process of incarceration and reentry. To start off, we will hear from Holly Cost and Tori Ho from Auburn University, whose pilot took the approach of working within the state system, engaging staff from various agencies to develop new pathways to help incarcerated individuals obtain ID prior to release. Over to you, Holly and Tori.
Great, thank you so much, Amelia. I'm Holly Cost. I'm the Assistant Vice President for University Outreach and Public Service.
Hello, my name is Tori Hone. I'm the Community Engagement Coordinator at Nebraska Medicine, and at the time of the project, I was the Graduate Assistant at Auburn. Before we get into the project, I wanted to make sure we understood why the project was so important. Through working with Alabama Appleseed and the Financial Health Network, we identified that lack of government-issued IDs created barriers to the financial health of those who are incarcerated. Without an ID, individuals are unable to access banking resources, secure employment, apply for housing, or access healthcare. This was especially important for the incarcerated population as they are being released without an ID or the minimum documentation necessary to obtain that ID. The goal for the pilot project was to develop a process or improve existing pathways to ensure individuals are released with an ID as they transition into civic life or ultimately improve their financial health. Before beginning the pilot, our team assessed all 50 states' existing processes and identified 2 exemplar states. We convened state agencies to gain understanding of their institutions' processes and to identify any existing barriers that may prevent them from obtaining IDs or minimum documentation necessary. With the help of the David Matthews Center, pathways were developed for 3 institutions. Lastly, we implemented the pathways with pilot participants to track successes, challenges, and recommendations for replication outside of Alabama and within. The 2 states that were identified were Ohio and Kentucky. In Ohio, released inmates are provided with release IDs serving as sufficient documentation for a non-driver's ID, driver's license, or learner's permit. Kentucky provides mobile units at institution sites that function the same as regional licensing offices. Both were important to note as the Department of Corrections does provide inmate release IDs and the law enforcement agency has a licensing mobile unit.
So essentially, our team took on a task of remapping a system that was not only broken, but was non-existent. And we did this in 2 phases. During the first phase, we held these convenings where we brought these stakeholders together who we knew were key to remapping this process. And if you see on the screen, you'll see all the stakeholders. Department of Corrections, that is the institution that manages our prisons in the state of Alabama. We also had Alabama Law Enforcement Agency, and they're the ones responsible for providing the identifications to people throughout the state. You'll see a few other agencies that were not mandated to be a part of the process, but we identified as critical to the process. The Department of Public Health issues backup identifications, and so we wanted to make sure that they were involved in the discussions. And then we did something a little bit different, and we identified 2 other institutions that either committed youth or incarcerated adults. That was Shelby County Sheriff's Department. They have a jail system there, and the Department of Youth Services, which houses our youth who are committed. We wanted to look at doing this providing identifications to people at different junctures in their lives, hopefully to keep them from ending up in the Department of Corrections. So when we started these stakeholder convenings, what was really interesting after the very first convening is that we asked the agencies that were there how often they did this. How often do you get together? And when they walked out of the room, they said, never. We've never gotten together before. So there was essentially no interagency collaboration at all. The important thing with this first convening also was that this established trust between the agencies. They were able to let their guard down and really make themselves very vulnerable in many situations. And the second convenings really drilled down, rolled our sleeves up, and we identified what are the barriers, what's the problem to getting an ID, and how can we fix it? So one of the big problems that was surprising to us is the Department of Correction, they were really just trying to stumble around, trying to identify how can we even manage the IDs when we get them? Where are we going to store them? These little pieces of plastic or the backup identification. So the individuals who are housed there, they really don't have any place to store things outside of their cells. With the opportunities, one that was incredibly enlightening and very heartwarming was that our Alabama Law Enforcement Agency, they want to get these IDs in people's hands. And so they have mobile units that they were able to take around to different agencies, and that worked out beautifully. So during this third convening, we developed this pathway, and you can look at the pathway there, but this pathway was really specific to each agency, but this is a very general pathway that we would take when the trusted individual from each agency meets with the individual to secure the ID. Best part of this process is issuance day, particularly for these kids. They get to walk out and they have this ID that says they are who they say they are, and they're one step closer to financial freedom. You'll see these proposed pathways there. I know they're writing small, but these are available to you. But this shows you the different pathways we've created for each different institution. And what's significant about them is that for each institution, the pathway would start at a different juncture, as in for the youth, the committed youth, it would start as soon as they walk in the door. With Shelby County Sheriff's Office, that was a little more challenging because they didn't know when they would walk out in the door or out of the door. So these are all the happy people at the Department of Youth Services. They get to work with these students every day to help them to have stronger lives. What we did, and I'm in the orange, Tori's over to the right, we supported these all of the agencies, and we checked in with them every single week to make sure that everything was going smoothly. And if it wasn't, we helped them to get where they needed to go. So this is our summary. We're super excited about this. Our goal was 30, which people said was a lofty goal, but we were able to, through this pilot program, test the system, and 52 individuals walked out with IDs in their hands. And these are non-driver's IDs. 50 youth and 2 Shelby County participants. And we'll talk about those numbers in just a minute. But significantly, the Department of Youth Services now integrates this into their process. They are fiercely committed to making sure that every child who walks out of that institution has an ID when they leave. Shelby County Sheriff's Office, equally committed, but they realized that they needed to get an external agency to work with them. So they worked with the Dannon Project out of the state of Alabama to help. Most devastating juncture really in our project was when Department of Corrections withdrew. Now, they did participate in these convenings, so the remapping is based on input from Department of Corrections, but when it got into doing the pilot and actually getting into the institutions, we weren't there, but getting the individuals who worked there to secure these IDs, they indicated we were moving at a pace that was too rapid and that they didn't have the accounting structures to manage the 10 identifications that we were asking them to try to secure. They did indicate that they were going to go in a different direction. So what we learned there is let's get some MOUs in the very beginning and to do what we can to understand the capabilities. We also learned that that relationship building was critical through those convenings. Also, the inclusion of youth. This was not something that we had to do, but we recognize that these IDs can change lives. So when people leave these institutions now, these youth, they want to go to college, they want to go to junior college, they want to go into some career training program, or they want to go out and get a job or a bank account. And now they can do it because they have an ID. So we're hoping that that will keep them from coming back into that institution. Another insight, if any of you are interested in replicating this, and we certainly hope that you are, we know it'll be different from state to state, but what we found is these stakeholder convenings were essential to establish this trust and create these new pathways. We actually got to meet everybody individually before we brought them in the same room together, because there was a lot of trepidation about people being in this room together, looking in their eyes and sharing these stories when they know things didn't go well. Nobody wanted fingers pointed at them. And nobody wanted to be in the paper because of something that someone said during this convening. So that was important. Another huge takeaway is that these pathways have to be incorporated into the system. This needs to be a standard operating procedure and not something that's just tacked on or that's done because somebody is super excited about it and they have this champion at their agency, because that champion will probably get recruited and taken away to go somewhere else. The identification storage, again, that was something that was surprising to us. So we went through a lot of discussion about that, but DOC, since they withdrew, I don't know really how they ever solved that issue. I just want to thank everyone for allowing us to be a part of this project. This is something that's now near and dear to my heart. It's a passion of mine, and we were just thrilled with the outcome. So thanks so much.
Wonderful. Thanks so much, Holly and Tori. The second pilot you'll hear about today, led by Stephanie Hicks of Restorative Strategies, worked with individuals outside the justice system who are residing at an inpatient drug rehabilitation facility. Stephanie's experience and background, which you'll hear about, allowed her to connect with the individuals living at the facility to help them obtain vital documents and open bank accounts. Over to you, Stephanie.
Good afternoon. My name is Stephanie Hicks. I am the owner of Restorative Strategies. I will be presenting the Birmingham Exit Pilot Program. The Birmingham Exit Pilot Program is a program focused primarily at the point of a participant's reentry. The pilot's purpose is, one, assisting returning citizens in obtaining essential ID documentation and establishing financial security through the use of safe banking products. With the assistance of the Empowerment Alliance, which is a local nonprofit organization devoted to advocacy for impacted individuals, we recruited participants from the Alethea House at the Men's Hope location in Birmingham, Alabama, which is a 90-day inpatient substance use disorder recovery program. The pilot's overview is essentially 3 parts. 1, attainment of essential ID documents. 2, facilitation of financial literacy education. And 3, connection to safe banking products. In this cohort, there was an intersectionality of substance use disorder and also interaction with the justice system. None of the participants possessed all 3 essential ID documents. Many needed a valid state ID. There were a wide difference in financial backgrounds. One participant even had owned a small business at one time. Many participants reported using predatory lending options to access cash, such as payday lenders and pawn shops. We worked with the Alethea House case managers in obtaining the ID that was still outstanding. One of the biggest challenges that we had in obtaining ID is that when we had individuals who were born out of state, we had difficulty trying to get those birth certificates. We had one participant whose name is Corey. He was born out of state, and we had some difficulty obtaining his birth certificate, trying to get his mother's maiden name. So unfortunately, at the beginning, we weren't able to get him connected to financial services. We facilitated financial literacy training using a modified version of the Consumer Financial Protection Bureau's curriculum by supplementing games and scenarios to make the material more meaningful. During peer mentoring sessions conducted by the Empowerment Alliance, participants had more in-depth discussions regarding finances and challenges, which fostered a spirit of camaraderie and shared learning. To secure a banking partner, I visited a few banks. When explaining the intent of the project, several bank officials were not receptive due to the population that was being served. However, PNC Bank was receptive to the pilot, and I believe this was mainly because the branch manager had a loved one that had been justice impacted, so there was a greater understanding about the purpose of the pilot and its need. Now, I want to note that I believe that the financial community is willing to support outreach to this population, but it may be beneficial to ensure this premise is enforced at all levels of the organization. These are our successes. Today, all individuals have accounts and continue to maintain a positive balance. And I must report that Corey was able to get his birth certificate and all his ID documents, and he does have a bank account. But I want to also note that many of the participants indicated having an active bank account was accomplishing one of their major reentry and/or recovery tasks. This pilot is an opportunity to reduce recidivism at the community level. Many reentry programs offer financial literacy, but do not provide a means for its immediate practical use. Pairing this pilot with a workforce development program would increase participants' marketability and put them on the path towards a faster and productive reentry. Timothy Lanier of the Empowerment Alliance, and he's seated in the photo on the bottom far left, is a nationally trained credible messenger who helped me a great deal. His program knowledge of the peer mentoring model assisted me with building trust and maintaining consistency in this cohort. Both Tim and I are justice impacted and know the challenges of reentry through our personal lived experiences. My previous work experience and formal education assisted me in managing the pilot program overall. However, it was my personal reentry experience which gained the trust of the participants to allow me to fulfill the full role of advocate, whether it was being an ear for them to tell me their stories and their challenges, to help with resume development, to help them navigate support services. Because I have walked through those challenges, I knew what they were feeling before they could actually verbalize it. This project's initial vision included a male and female cohort classified at different custody levels at 2 different locations. While most studies encourage beginning a reentry process prior to release, challenges with implementation presented in our state's correctional system did not make that a feasible option. In order for this pilot to be implemented at the custodial level, there must be a collaborative relationship with the correctional institution's leadership and program facilitators. Moving forward, there's a greater need for gender-specific programming locally and nationally. According to the Prison Policy Initiative, in 2021, about 10% of the incarcerated population were women. Women's reentry experience impacts not only themselves, but also, in many cases, their children. The struggle of reentry is especially difficult for women because they are most often the primary caretakers. Therefore, I believe providing meaningful financial literacy education coupled with job skills training is a tangible avenue to reduce recidivism through a practical reentry strategy. I appreciate your time and attention in listening to my presentation. Thank you so much.
Thank you so much, Stephanie. The third pilot was led by Lee Langston of the Alabama Nonviolent Offenders Organization, with collaboration from Ken Walker of Bank On and the Alabama Asset Building Coalition. Lee describes his pilot as a bridge between working inside and outside of the justice system. The pilot participants were recently released individuals at the Day Reporting Center in Huntsville, Alabama. Over to you, Lee.
Thank you so much. Again, my name is Lee Langston. I am the interim executive director for Alabama Nonviolent Offenders, who help individuals that are previously incarcerated really get a second chance and make sure that this time around that they can sustain themselves. So our actual pilot was here in Huntsville at the Day Reporting Center, and we assisted about 25 individuals. And those individuals were there making sure that they were able to get all of their documents. But unfortunately, when they came in, like Leah said, a lot of them did not have their documents. We collaborated this pilot program with Bank On as well as United Way, and they were the ones that actually helped provide the financial literacy education to help us navigate that and make sure that we do have safe banking products, checking, saving, and credit score information for our participants. So my role was to help them to, again, navigate and make sure that the needs that they had, again, coming out of a incarcerated situation, and most of those folks, when they came into the program, did not have Social Security cards or birth certificates. So we made sure while they were going through the Day Reporting Center, they had to be there Monday through Friday, 8 o'clock to 4 o'clock every day. That we just made sure that they had all of the proper documentation. As I mentioned before, Bank On collaborated with us. This is Ken Walker, who is one of the persons that really helped us with that. Bank On's goal was to ensure that everyone has access to safe and affordable banking or credit union accounts. That made sure that here in Alabama, predatory lending is common. And we want to make sure that high interest rates, like it says on the slide, 400%, or any other unfair lending practices, that those particular people did not get caught up in that. So Ken and I helped our folks navigate that through two things. One was making sure that we had about 10 or 15 banks that we went out and looked at to ensure that these individuals would have safe and affordable banking products. And we wanted to make sure that some of their professionals, the bankers in these banks, actually had an opportunity to become our what we call subject matter experts in these sections. So we offered 14 sessions in this financial literacy, which was based on your money, your goals. We wanted to make sure that from the participants, they had an opportunity to improve their credit scores. Matter of fact, one person even had an issue with their IRS debt that one of the bankers helped them with. We wanted to make sure that participants were able to find and use these banks to be able to open up their banking accounts. And we use the process, what I would call a incentive at the end that actually help navigate and get them to the finish line. We also, for some of the individuals, we made sure that they had safe deposit boxes where they could actually secure their documents for only $20 a year. The successes. 82% of the folks that went through our program completed it. And at the end, we gave them, again, the incentive as well as a certificate. Individuals got their Social Security cards as well as their state IDs, and still 62% plus folks still have open bank accounts and are still banking with those original bankers. Looking ahead, the Day Reporting Center here in Huntsville are so excited that they are already, we've already started, it'll start in November, another class at the Day Reporting Center where we'll have about 15 individuals going through that class. We also have another class that's going to be beginning in late November in the community through our peer support group. We want to continue to check on them quarterly to make sure that the participants are still meeting their goals, getting the rest of their documentation, and making sure that they are continuing to move toward their progress toward self-sufficiency. And we want to continue to have these financial experts to help us with these classes, as well as access to safe banking. Again, there were several individuals, but these three individuals are the ones that I really wanted to speak to. And we created in this Your Money, Your Goals, a practice of not just giving a person a hand out, but a hand up. And that hand up would help them to get to their goal of becoming self-sufficient. One individual, I might add, started their business through a lot of the information, practices, and et cetera in the classes. And they started their business, and they have the hopes now of having at least one other individual helping to work with them and assist them in their projects. So again, we want to thank this group, Financial Solutions Lab, for helping us with this. And we hope and pray that more is to come with these endeavors. Thank you.
Thank you so much, Lee. The fourth pilot involved a collaboration between several community-based organizations. We will hear from Tari Williams of Greater Birmingham Ministries, who will share how her pilot worked within affected communities, engaging community members to take the lead in providing services and offering clinics to recently released individuals. This pilot also developed an amazing resource that we're very excited about that can be used by both community-based organizations and state agencies who are working to help justice-impacted individuals. Over to you, Tari.
Thank you. My name is Tari Williams, and I served as the contact lead for the team that implemented the Alabama ID Navigator Initiative. The goal of the Alabama ID Navigator Initiative was to address the large numbers of individuals being released back into a community without state-issued ID. By doing this, we trained and deployed ID navigators to assist returning citizens. We offered ID clinics, and we developed a comprehensive reentry resource manual that included information on identification documents, how to acquire them, and financial resources available. Our ID navigators were recruited directly from the community. These are the individuals that gave our project a level of trust and credibility. It also, our ID navigators were able to recognize unspoken and unseen needs. The navigators led the ID clinics, and talk to individuals about the importance of ID, the process to acquire the documents, the cost associated with the documents. And these clinics were often held in the community, such as community centers, community colleges, and libraries. We traveled to over 10 counties and cities with pop-up ID clinics. Our information, our financial products information was provided by one of our partners, which is First Step Alliance. And they also had information about their DORA app, which is a certified bank-on app. The participants were individuals who were directly impacted or indirectly impacted by the criminal justice system. So either they had firsthand experience with incarceration, or they were the family member of someone who was formerly or currently incarcerated. Our collaboration was a team of 3 community-based organizations. Greater Birmingham Ministries is a nonprofit that provides direct services and systems change and justice advocacy. First Step Alliance is a nonprofit committed to improving the financial lives of formerly incarcerated individuals. And Jimmy Hill Mission is a nonprofit that services substance abuse recovery individuals formerly incarcerated, and they also provide education and ready to work services. The pilot did have a few challenges. We realized early on that working with participants in transition is extremely labor intensive. And by that, I mean that we often had more than one call and one contact with individuals. It required numerous follow-up calls, reminders, and answering questions, and helping individuals navigate child care and transportation issues. The pilot's original intention was to collaborate with state agencies. However, we found many state agencies non-responsive, and so we had to pivot. And we also learned that not all vital record offices followed the same protocols, which often made acquiring documents more difficult. The summary of our impact: we had 3 trained navigators. We held 15 clinics across the state. We served 167 clients, in which 128 received some form of identification document. Either they received a photo ID document, or they received a birth certificate and or a social security card. And we developed plans for 39 individuals who had more complicated issues and situations to work through. Our Alabama Reentry Guidebook for ID and Financial Services was one of our main products that we produced from this pilot. The guidebook includes information about the cost of identification documents and where to find it. It also answers questions about other types of ID, such as veterans ID, voter registration and restoration information, and it also talks about the important use of documents. It provides information on banking products, credit scores, identity theft, and things of that nature. Our insights, some of the lessons learned from the pilot is taking care of our community navigators, because understanding that they are often facing some of the same challenges and issues in which they're helping the clients through. So making sure that we're providing them with the proper support. Also understanding that many clients have a fear or distrust of government systems, and that the ID navigators are needed to help them ease that fear and concern. And formerly incarcerated individuals face so many daily challenges and barriers to getting an ID that we often had to help them navigate other issues such as transportation and childcare. Some of the insights is that this is about building relationships and not just about transactions. So understanding that our pilot really did change people's lives. We helped grandmothers get their grandchildren enrolled in school and learn about free internet access for the grandchildren. We also helped individuals study and practice to take their driving exam. And so projects like this often reduces recidivism because it allows people to become really fully functioning members of society. And we also understand that, when people are in desperate situations, they do desperate things. And so we want to make sure that we're keeping them in a position that's providing hope. Thank you.
Thank you so much, Tari. Before we close out today's webinar, we're delighted to welcome Diane Standard, Senior Engagement and Policy Fellow at the Consumer Financial Protection Bureau. Diane will give an overview of the Bureau's recent work in the reentry space and some of the resources the Bureau makes available to people and organizations like the ones in attendance today. Over to you, Diane.
Great. Thank you so much. Good afternoon. My name is Diane Standard. Presentation does not constitute legal interpretation, guidance, or advice of the Consumer Financial Protection Bureau, and any opinions or views I state are my own and may not represent the Bureau's views. Just to introduce you all a little bit to the Consumer Financial Protection Bureau, it sounds like others have worked with the Consumer Financial Protection Bureau before, such as the Your Money, Your Goals curriculum. We are so thankful for that partnership, but we also wanted to provide information about the Bureau that may be helpful as you all continue the work to increase the financial inclusion of justice-involved individuals. So the CFPB is a federal agency dedicated to making sure people are treated fairly by banks, lenders, and other financial actors. It was created following the foreclosure crisis of 2008 to help prevent unfair, deceptive, and abusive practices. Importantly, the CFPB has the ability to act. Since its creation, the CFPB has returned over $13 billion to consumers. So it can take action using a number of tools. One set of tools is our regulation, supervision, and enforcement tools to hold financial institutions accountable for treating people fairly. We also have the tools that we'll talk about today through taking consumer complaints. We can issue research and data, and importantly, we can arm consumers with information to help navigate the financial system. So I'll share a few examples of these tools as it relates to the experiences of justice-involved individuals. In using our enforcement tool, here are two examples in this area. So the CFPB currently has pending litigation against a company called Libre by Nexus, in which the Bureau and states accused Libre of luring non-English speaking immigrants into abusive English-only contracts. Libre's business model preys on immigrants, primarily Hispanics, who speak little or no English and being held in federal detention centers who are desperate to return to their families. And another action in a recent settlement with a public action against the company JPay for charging customers fees to access their own money on prepaid debit cards that they were forced to use. Additionally, the Bureau found that JPay violated the Electronic Fund Transfers Act for requiring consumers to sign up for a JPay debit card as a condition of receiving their government benefits. In the end, the Bureau required JPay to stop charging fees on their debit release cards, pay $4 million to compensate consumers, and pay $2 million in civil penalties. As an example of our data and research tools, in January of 2022, the CFPB released a first of its kind report on the experiences of justice-involved individuals in the financial marketplace. It is a great starting place for anyone to have a helpful scan of the various products and services that people must use to make their way through the criminal justice system. It looks at pretrial experiences during incarceration and upon reentry. For example, it highlights the challenges that people may experience in simply trying to manage their own accounts or payments while incarcerated. It also highlights the various types of fees and payments that people encounter along the way and challenges to reentry, such as trouble accessing affordable banking products, like we've heard a little about today, difficulties resolving errors in criminal background checks used for employment and housing, and also the challenges of how a criminal background may lead to limited access to small business loans and capital. In the report, we do indicate that we are very interested in continuing to learn more about the experiences of justice-involved individuals in the financial marketplace. We continue that learning through conversations such as today's and the very important work that you all have been doing, as well as through our ability to receive consumer complaints. this complaint tool is an incredibly important way in which the Bureau informs its work. So we have the ability to review complaints to see if there are emerging patterns or trends. In addition, our system is set up so that when a consumer submits a complaint through us, it forwards it to the financial institution as well. People can usually get a response generally within about 15 days. So one of the materials is a one-pager that you could use in the community or in your own networks about how to submit complaints to the Bureau that speaks specifically to the experiences of someone who's incarcerated or a loved one who is incarcerated who may be able to submit a complaint. So we really look forward to hearing more experiences through that manner. So this is just one example of a type of complaint and information that people are sharing with us through our complaint system. And here is a story about a challenge that someone had in accessing their student loan deferment while they were incarcerated, and then how that lack of access contributed to the default on their loans and incurred the stacking up of fees as a result. So this is the type of information that is helpful to the Bureau's work in a number of ways. So just to close with a comment about the tools to arm consumers with information to navigate the financial marketplace, you have heard this afternoon about the series that the CFPB has called Your Money, Your Goals, which is helpful across a range of financial topics. But here I just wanted to highlight one of the companion guides that is specific to the experiences of justice-involved individuals. It includes things like a checklist of what you can do to prepare and protect your finances prior to incarceration, as well as guides and resources for smoothing reentry. Just thank you so much again for allowing the CFPB to be part of today's discussion. We are really open to hearing more about these experiences. Please feel free to contact us anytime. Thank you.
Thank you so much, Diane. And thank you to all our presenters today, and to Alabama Appleseed and TYTHEdesign for co-hosting today's webinar. And of course, thank you to all of you for being with us on Zoom today. You will find learnings from today's presenters and from other grantees Financial Health Network has worked with in the reentry space in our forthcoming report to be published in January 2023. So stay tuned for that. And we really hope this webinar has served as a call to action to help people who are leaving prison access the tools that they need to thrive and build their financial health. Again, thank you all for being with us on today's webinar. Be well.